Good evening, everybody, and welcome to tonight's class on what is regular care. So a lot of people ask me about this, what does regular mean? Or what is normal, right? Or what is this or what is that? Well, a lot of times people will talk about normal, like it's normal to have headaches. It's not. Is it common? Yes, but it is not normal. Normal frequency of headaches is 0 in your life. Let me say that again. Normal frequency of headaches is 0 in your life. Okay? That's not what we commonly see. So what is regular care? Well, regular is that variable word, right? What is it recommended for you for care? Well, it's recommended with absolutely no issues. Okay, so this is no complications, no problems, no nothing. It is recommended to get checked once at birth and once a week thereafter. So, what does that mean? Well, if we're talking once a week thereafter and you're 20 years of age, that's roughly 20 times 5. So you get, that's like 1,000 roughly, somewhere around 1,000, 1,100 missed opportunities to correct a problem, if the problem may arrive. Does it mean when I say getting checked once a week, does that mean getting adjusted? No. Okay. It doesn't necessarily mean you're going to get adjusted, but if we check you, sorry, my alarm went off there. If we check you and you have a subluxation that needs to be corrected, then we adjust. But if we check you and you have no subluxations, we do not adjust. Many of my patients know this because I will go through and go to adjust and I'm like, hey, I don't have to adjust that today. Or, hey, look at that. The right side of your neck is doing really good. We don't need to adjust it. Or your left pelvis is fantastic. We don't have to adjust it. It's wonderful, wonderful when we don't have to adjust. It's actually one of the most wonderful things I could ever see in practice. Now, how often does this happen? Not often. Okay. Why? Well, let's face it. What do you do outside of my office? Have you completely changed everything that brought you into my office? Probably not. Have you been doing all of your exercises as you've been directed to do them? Take a guess what percentage of people actually follow through and do their exercises as prescribed? 2%. So if you're part of that 2%, most likely, okay? Are you getting checked regularly or are you coming in for just pain and symptom relief? Because let me tell you, if you're coming in for pain and symptom relief, you're never going to get to a point where I check you and you don't have something going on. Sorry, it's just what it is. If you start care after the age of 40, your chances are much less that you're going to have those checked times where I don't have to adjust. It's been 40 years of damage to your spine. So it's going to take 40 years or more to correct those problems, right? Does that mean it's not worth it? Absolutely not. You should still get checked because if I can get you to 100% of your possibilities, even if that maybe that 100% possibility isn't 100% of what is normal, but it might be 60%, but right now you're running on 40% of 60%, right? Not good. So we want to get you as much relief, as much function as we possibly can for you. So what is normal care in our office? Well, shocker, normal care in our office by my recommendations is no less than once a week care. Meaning you get checked once a week. Does not mean I'm going to adjust you every single time, but you get checked. So, why once a week? Well, first of all, that's the recommendation, right? That is what scientifically has been proven for recommendations. And there are MDs that recommend that exact thing as well. So it's not just chiropractic bias, right? There's also proof that shows that if a subluxation occurs, scar tissue can form within 24 to 48 hours. Okay. So an injury can cause scar tissue formation in as little as 24 to 48 hours. And if left uncorrected within 5 to 7 days, permanent, irreversible damage can be done. That sucks. Okay. So why do I recommend once a week care? Because if we're getting you checked every week, if a subluxation occurs, if an injury occurs, we can correct that and hopefully stop permanent, irreversible damage from occurring. So let me ask you this. If you know for a fact that permanent, irreversible damage occurs within 5 to 7 days of an injury / subluxation, okay, if your doctor knew that, would it be unethical and against like the Hippocratic Oath for them to recommend less than once a week care? If you said yes, I absolutely agree with you. That is why I never recommend less than once a week. Now, do I have patients that come in less than once a week? Yes, I do. Do I encourage them to do better? Yes, I do. Do I love them for who they are and I love them where they're at? Yes, I do. And I do what I can to help them as much as I can. Okay. I don't have every patient coming in once a week. I have some patients come in once a month. I have some patients come in every other week. Or I have some patients that come in only for pain and symptom relief. And at that point, I am a very expensive version of an aspirin. It's not what I recommend, but it does happen. But I would say of that population, those last 3 are much less of the population of our patients than getting checked once a week. The vast majority of our patients want to achieve their absolute best. And so they get checked once a week. Now I have a 80, I think he's 84, might be 85 this year, 84-year-old patient, 85-year-old patient that comes in and he gets checked once a week. Now he's been checked once at birth and once a week thereafter. Now, right now, he's not getting checked by me, but he's getting checked by his chiropractor where he's at. He's one of the snowbirds, right? That shares time up here in northern Michigan and shares time somewhere else. That's all I'll say. I won't tell you where because you might figure out who this patient is. So he comes in and it's fun because he'll come in and he'll say, oh, I'm definitely out today. I need to get checked and I need to get adjusted. Well, he'll lay down on the table. Sure enough, more times than not, he's correct. He's out, and we adjust him. And other times he'll come in and say, I'm just here to get checked. I think I'm doing really well today. I don't think I need to be adjusted, but I know I need to get checked. And so he'll lay down, and I'll check him. And honestly, more times than not, he's right. And he doesn't need to be adjusted. And I give him a big high five, a big congratulations, and tell him, I'll see you next week. Right? It's amazing to see how his spine has literally 0 degeneration. His discs are nice and healthy. His bones are nice and smooth. There's no arthritis. But again, he's one of those very few people who have been checked once at birth and once a week thereafter. So, why is this so important? Well, many people out there right now have children, grandchildren, nieces, nephews, cousins, etc., that have children that need to be adjusted or checked at least to see if we can help them. We have patients who their babies aren't crawling. They're wanting to stand. Anytime they try to crawl, they fuss and complain. They can't lie on their back. They have to sleep on their stomach, etc., etc., etc. Those are all signs and symptoms that there's a major problem with their spine. And you'd be surprised how much better they do when they do come in and get checked and get adjusted as needed. It's really cool. Okay. And those kids that we start out like that never have the problems you and I have. Okay. they don't end up going into phase 2, phase 3, phase 4 degeneration. It's really cool to watch. It's really cool. So, what is my goal of this video? My goal of this video is to educate you that the biggest reason why I recommend once a week care is that if a subluxation occurs within 5 to 7 days, permanent, irreversible damage can be done. So my recommendation is to get checked and adjusted as needed so that that permanent, irreversible damage does not occur. My goal for you is to get into your chiropractor on a regular basis and make sure that you are achieving your optimum best, your best health and functionality. If you happen to be in Northern Michigan, that'd be this office, right? I have patients that travel, way further than I ever would imagine. And I'm very grateful that they do. And my heart is huge because they do this. They travel from Charlevoix, from Bel Air, from Mansalona, from Alba, from Kalkaska, from Grawn, from Traverse City. They travel all the way out from those areas to here. I mean, we're talking some cases 40 miles. It's amazing what I see. And I'm honored to be their doctor. Honored to be their chiropractor, right? So I'm saying Northern Michigan because I've seen people come from a long way to our practice because we just treat people a little different in a good way, right? You're never a number. You should always feel as though you're part of our extended family and that we'll always show you love here. If you happen to be in another area and you're looking for a chiropractor, I'm more than willing to do what I can to find you somebody in that area because I want the best for you. I want the best for your family. And most of all, I want the best for the communities that surround us. That's why I do these classes. So I hope you take something away from this. And if you're coming in once every other week, once a month, or only when the pain occurs, I hope you're stepping up your care a little bit. Maybe you're not going to go all the way to once a week, but maybe you're going to go from coming in only when the pain hurts to coming in once a month. Or maybe you're going to go in from once a month to every other week. That's huge. It's huge. And I applaud you for making those changes. Now, I will let you guys go and wish you the best spinal health. There will be a class next week that I'm going to do. But next week, February 10 through the morning of February 19, this office will be closed. We will reopen the afternoon, so at 2:30, February 19, and we'll be open that day, Thursday, our regular hours, Friday, our hours that we typically have on a Monday, Wednesday, or Thursday, so it's 8 in the morning to 6:30 at night with a close from noon to 2, or noon to 2:30. And then Saturday, we're going to be open 9 to noon because we are going down to celebrate my wonderful mother-in-law's 80th birthday, as well as Crystal's birthday and her brother's birthday. So we're all going down to Florida. Crystal, myself, and even Pixie, our little dog, are flying down to Florida to spend a week and a half with them. And we will be back, and we will see all of you bright and early. Now, if you have time to get in before that, do so. We're open Wednesday, Thursday, and Saturday. Wednesday, Thursday, regular hours. Saturday, 9 to 11. Okay? So make sure you get in. And as always, have a beautiful, wonderful evening. Thank you, and good night.